Weight loss. You've been told it's all about eating less and moving more. Why are we told that, and why is it not working? Well, I can tell you, I have patients that come into my office every day and they're like, Dr. Keenan, I'm doing everything right. I'm eating the right things. I'm going to the gym, but still they're keeping the pounds off. So what is the problem? One of the biggest problems is insulin resistance. And if you don't know about this, you need to learn about it. Maybe you went to your doctor and all your blood work came back normal. They did your blood sugar, your diabetes test, they said it's all normal. Well, guess what? Insulin resistance can develop 10 years before you have diabetes. And it's in those early stages of insulin resistance that you have difficulties losing weight. So what are the 4 key drivers, I feel, to insulin resistance? So one of them is your gut health. If you are having trouble with your bowels, with constipation or diarrhea, then you're going to have trouble digesting, absorbing food. There's going to be inflammation and your body is going to be out of balance. All of those factors can begin to drive insulin resistance. What's another thing that can impact it and weight gain? Number 2, you need to think about your sleep. The amount of people that don't get good quality sleep, that are feeling not rested in the morning, and the amount of sleep apnea that we see is really overwhelming these days. So if you're having problems still losing weight, think, do you have sleep apnea? Or are there things that you're doing at night that you could do to help to improve the quality of your sleep? Number 3, stress. How many of us are in this cycle of feeling overwhelmed and just kind of go, go, go all the time? What does stress do? It drives cortisol. Cortisol is the hormone that's going to drive insulin. And when you have a lot of stress, it's really hard to get insulin levels down to release the fat from your fat cell. So you can try again and again, and you can do all the right things, but if your stress is too high, you're really going to struggle with your weight. And number 4 that I want to talk about is hormones. So both ladies and gentlemen. So for women, if you're a younger woman, if you're having irregular cycles, you have to begin to think about polycystic ovarian syndrome. This really drives weight gain because you have too much insulin and often too much testosterone in your body. If you're a mid-aged woman, or if you're going through a menopause transition, basically any woman from 40 to 60, then your estrogen is beginning to shift. And as estrogen shifts, what does it do? It can drive insulin resistance. So all those things that you used to do, going to the gym, eating healthy, and then you start to pack on the pounds because you want to work on getting those hormones in balance. And for men, it can be about testosterone, right? So men as well. We used to see the dropping of testosterone levels more into the 60s. But for a lot of reasons, men are starting to drop their testosterone now well into their 50s and even into your 40s. So if you're a man that's struggling with weight gain or brain fog, mental clarity, or depression, think about your hormones. So these 4 drivers is a reason why the whole thing that you're being told to eat less and move more may not be working for you. So you want to address those drivers. So remember, start by first getting your blood work done. Ask for an insulin level, and a blood sugar level. Or if you can't get into your doctor and you can't get your blood work done, go out and buy the Freestyle Libre device. This is a continuous glucose monitor. You wear it for 2 weeks. It is going to open up your eyes. If you wear it for 2 weeks and it doesn't open your eyes, then you can please let me know, because every patient that puts it on has remarkable changes to their dietary patterns when they wear the Freestyle Libre, because it shows them the body's response. So start with those things and then begin to think about your gut health, your hormones, your stress, and your sleep. I hope that's been helpful because when we start to tune into our body, when we take things back into our own hands, this is the key to your health. My practice right now is getting really busy. People are coming to see me because I listen, but also I want to teach you the drivers, and a lot of drivers come from our lifestyle. There's advanced things that we can do together, but you can start to take things back into your own health by sharing some of these things, working on your, like I said, glucose regulation, knowing what that's like, and work on those 4 pillars of health. Hope you have a wonderful afternoon. It's still a snowy day here in Miramichi. It is spring, but it feels a little bit like winter. Have a great one, everyone. Bye for now.